Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. Hello. How
Hello,
are
good morning.
you? Good morning.
Yeah, I'm doing good. What about you?
Yeah, good. I know it's morning in India. Plus, there's a lot of preparation going on for Ram Mandir that I'm very excited about.
Yeah,
How's
it is.
everything going there?
Everything is going good. Everything is Ram, Ram, and Ram in India
I know it's
because
been going on since so long, the preparations
since 500 years they wait for that
and
particular thing,
yeah,
and generations they all are fighting for the same thing, and lot of judgment came in favor, and after that other things are happening now.
right. Yeah,
Yeah,
but I'm
India.
glad finally tomorrow is going to be the inauguration for Ram Mandir. And
Yeah,
that's good. But yeah, it's causing a lot of inconvenience with the public. But yeah, I hope everything is good there.
yeah, everything is good on. Yeah, that's
Okay, let's start.
yeah.
So
In
today,
India, that's each and everyone is supported. That's all religions are with that particular thing,
oh, definitely.
and there's a very good acceptance of each and everyone. Yeah,
That's what I love.
yeah,
That India being so diverse
yeah,
with cultures, religion, backgrounds, but there's still so much of acceptance and love for each other.
yeah. The diversification is there, but each and everyone is joined like anything, and they are working together.
Yeah,
That's
yeah,
the
I love
best
that.
thing. Yeah,
Okay, let's dive in for
yeah,
today's session.
yeah.
Are
Please.
you?
Even I am excited for the thing.
Yeah, me too. We've been planning it for so many months, but the
Yes.
time or something was coming up, so we couldn't do it. Finally, we are here for today's session, so I'm really happy about that.
Yeah. Yes,
Okay,
please.
let's start. Now you're ready. Now you look ready.
Okay. So you can go ahead. Yeah,
Yeah,
please.
let me start by asking my favorite question. What is health and what is fitness according to you?
Okay, that's a very good question. But fitness will be different. You can say from age to age. In
Right,
30s, that is different. In 40s, that is different. 50s, that is different.
right.
But this, I am 44,
No,
and
you don't look 44.
I'm not look 44, but I'm 44. So I can say, as per my fitness, if you are able to run for 5 kilometers without a stop,
Right,
and you are able to do in 30 minutes, then you cardiac things are fit. And
right,
if you are able to work out 3 to 4 times in a week, that's quite good. And
right.
as per fitness, and in fitness, Bhavna, we go to a lot of corporates.
Mm-hmm.
In India, people are workaholic. They do a lot of work. The Monday
Mm-hmm.
to Saturday, even some corporates they're working on Sunday also. So
Yeah, I know.
every time they will ask that we don't have time. We don't have time.
Right.
So every time I say if you don't have time, then run because you may have 15 minutes, then run. If you don't have 1 hour, then no need to do exercise. You have to run.
Right.
So,
Yeah.
that's the thing. But we need to be do fitness activity each and every day. And
Yeah.
for the health, I will take mental health above compared to physical health. Because if we are mentally healthy, if we are able to do for ourselves, then we can do for
Right.
others. Until we are not able to do for ourselves, we can't do for others. So for health, so mental health will be the priority. If that is okay, then everything is okay. You,
That is
you
so
can do for others.
right.
Yeah. So this my original thinking for the health and fitness. What life make me learn
Yeah.
in these years. That's the thing.
I love the way you put it because I grew. I was born and raised in Pune in India, and I also while growing up we never took mental health. We didn't even know what that was. Mental
Mhm.
health awareness is growing to another level right now, and I'm so happy to see that India is such a developing country, and it's developing in all sciences including healthcare, that
Yeah.
we are considering mental health to be more important than
Mm.
physical health and other aspects of health.
Yeah. The maximum cases of fibromyalgia and pain you will
Right.
see, that's maximum time they are increased or the symptoms are more due to mental health
Right.
because that will disturb a lot in day-to-day cases. What we see, the sleep is not good, sleep is not deep. That's causing a lot of difference to our physical
Mm-hmm.
health. So just we need to maintain that particular thing because there are a lot of disturbance to make us mental unhealthy. You can say there's a lot of things and the whole of the day
Right.
because the people say you must be positive, you must be positive, but I don't think so. This you need to be force yourself too much to be positive. You
Right.
must be internally, you must be positive for each and everything.
Yeah.
And whatever activity you will do, you have to do it 100%. Just now I'm talking with you and I have to do it 100%. I not
Right.
to be see here and there.
Yeah.
And that's the kind of meditation.
Right.
Exact thing is meditation. If you are doing any work, if you are eating, then you have to eat.
Right.
And while eating, you are not supposed to go to office. Whenever you are office, you have not start eating.
Right.
Well, start eating in the brain,
Yeah.
not exactly. But which one work you are doing, you have to do it 100%. Whatever.
Yeah.
That's the only pure form of meditation, and that will really help you to become mentally healthy, peaceful, and happy. But if you are doing multi works, two works, three works at a time, you are eating and talking with someone and guiding another one. Yes, everything will be load on your brain.
Right.
Finally, this is a 850 gram, and you are overloading that particular organ. That's the
Yeah.
thing.
Plus, you're not focusing on one thing 100%. Your dedication towards each work is distributed, so you're not able to do anything best to your ability.
Yeah,
Right.
not best, but that's concentration become poor after a
Right.
long. Uh, concentration become poor after a long.
Right.
So each and every day, that I'll try to focus my activities.
And then
That's the only thing. Yes, please.
this this is one of the reasons why you hold a Guinness World Record and others don't. So your
That's
dedication and your 100% towards every work that you're doing is a proof that you deserve it and you deserve to be where you are today.
I'm the lucky of the cycling team or cycling foundation which we made in Greater Noida, and after that, this we are the part of a Guinness World Record over there.
I
And
wanted to
except
ask you, what is the award about?
that's this is a longest cycling chain we made. That's we started a cycling foundation in Greater Noida. I am from Greater Noida. This is
Right.
near
Mm-hmm.
to Delhi, and we make a GNCC, Greater Noida Cycling Club,
Wow.
and this we people and our one army wing CISF. That's
Right.
we taken as a joint venture to make the longest cycling chain. Guinness record. It's a kind of a 5 kilometer longest chain, and each and every cycle was kind of 3 feet or 3 to 6 feet away. That's the
Wow.
only thing. And we have to do it 5 kilometers. And we did with joint effort of our Indian Army wing, CISF, and that was very good. And after that, we have a Guinness record holder, Mr. Rohtas Chaudhary
Right.
also. He's our player,
Mm-hmm.
and he made two Guinness records.
Right.
So I was excited. Even I do same thing.
Yeah.
He made two Guinness records, Rohtas Chaudhary, as he hurt his shoulder,
Oh no.
and he came to me. Just we in the rehab and all these things. Shoulder was okay. He came to me, and he told me that he want to make a push-ups record. Then I told him, why you want to go for that particular thing? Your shoulder is not good.
Yeah.
So, okay, but this, well, this is okay. This you can do, but no, he's a very good guy and very, you can say, a very good mental strength. He have God gifted
Right.
him that particular.
Yeah.
Yeah, he told me that he have to make a Guinness record of 10,000 push-ups. I heard
Wow.
1,000, and I told him 1,000. This is too much, yeah. You are not supposed to do that. No, not 1,000. I want to make it 10,000, man. So
Wow.
he made that golden book of record for that thing. That after that he made two Guinness records.
Wow.
So I was part of that and part of my Guinness record also.
Wow.
So that's kind of a motivation for my fitness and all these things. Because if I'm looking good, I'm healthy, I'm fit, then I can say people to do exercise and all these things. If I'm not that okay, that I can't
Yeah.
say. That's the thing.
It
Yes.
it's so important to have the patients motivated.
Yeah,
That's a big,
definitely.
big role. And I
Huh.
believe a lot of my patients are over here. But then there are a few that I have to be double motivated just for them.
Mm.
So I'm like, come on, you got this. You have to give me 10 push ups today. Even if you're tired, you have to do this. You have to give me
Yeah.
10 squats. So I understand where, the motivation factor plays such an important role.
Yes. Yeah, definitely. That's because we have to be. I told you earlier also, if we are mentally and physically healthy, then we can do something for others.
Yeah,
Yeah,
that's true.
that's the
Tell
thing.
me about your rehab. How did you start your rehab? What idea did you have in mind, and what it is today?
Yeah, I did my graduation from Karnataka.
Right.
Then at that time, I searched the best hospitals in physiotherapy are in Pune. So I gone
Of
to
course.
Pune, Ruby Hospital, Ruby Grant Ruby Foundation.
Yes.
That's the
Yes.
famous thing, and
Uh-huh.
they are doing very good in rehab at that time.
Mm-hmm.
I was supposed to be the topper in Karnataka, but whenever I reach to Ruby Hospital, then I know that I don't have that much knowledge.
I did my internship from Ruby too.
Oh, in which year you did?
2019, because I graduated 2020. So 2020, 2019.
Oh, I was there in 2003, long
Oh, wow.
back, long
Really
back.
long back.
Yeah. And then after that, I started working with the Sancheti Hospital because they are the best in
Yes.
orthopedics. That's why I searched
Mm-hmm.
Pune. After that I went to excel in rehab, then gone to MIUH Kolkata for the orthotic wings.
Wow.
From where that I got a very good knowledge of orthotics. Because these are the most important thing in rehab,
Yes.
any kind of rehab. If you have a good knowledge or decent knowledge of orthotics, you can help a lot.
Yes.
Sorry, because in Sancheti they are doing very good work at that time also.
Yeah.
In long back 2003, I think now they are developed more. Then I started working with Naveen Hospital and Maxons. Then I started in 2010 our own rehab. This is Advanced Physiotherapy and Rehabilitation Center (APRC), and
Uh-huh.
that is starting pretty well after 2 3 years. And you can say now we are seeing almost you can say 300 to 400 patients per day
Per day.
in our different chain of
Wow.
clinics, and you can say that's lot of Olympians, Paralympians, they are coming
Wow.
to us. And golf, that's my favorite super specialty is golf. I'm working with a lot of golfers. It's a very cool game,
Yeah,
and
definitely.
I really enjoy that particular thing. As I was in European tours with Subhankar Sharma, learned a lot over there, and learn the golf
Yeah.
mobility, how we can help golfers, because that's play a very good role for the golfers. If the mobility is proper, then they can hit pretty well. and uh, and a lot of things I learned in rehab, Bhavna. Just maximum time, this elbow, this tennis elbow is there, golfer's elbow is there. Just
Mm-hmm.
maximum time earlier we are treating over the elbow. But after
Right.
that, I find it out that thoracic mobility is the most important factor that will causes problem to elbow
Wow.
in sports. Because if thoracic mobility is not there and you have a good strong shoulder, then maximum load will coming to your wrist or elbow. Injuries happening secondary due to your impact of your thoracic mobility that is less, and that is causing problem to your elbow. So these are the things I learned over a period of time. Now we are taking care of the thoracic mobility also.
Yeah.
Earlier, earlier our victim was elbow only.
Just elbow. I am still seeing so many patients with tennis elbow.
Yeah.
Because I have a lot of software engineer as my patients,
Mm.
and I'm just treating their elbow. I like to cover a joint before and a
Yeah.
joint after. So I
Okay.
always focus on shoulder, a little bit of chest, and
Uh,
lots of wrist,
yeah.
along with. But I noticed that they're not 100% better. It's always 98, 99, and they're always
Okay. That's
working.
good.
So
Uh,
I'm
uh,
going to start applying this
thoracic
thoracic
mobility. Yes.
ability.
Yeah. That's really work because this maximum of you can say techie guys they have mild kyphosis, thoracic kyphosis, and they hardly go for anti-gravity exercises to
Right.
make their posture perfect. So maximum time they have problem due to that only. That's the thing we need to take care.
What
So these are things we,
exercise? I'm sorry to cut you
yeah,
off. What
yeah.
exercise do you have them do for good thoracic mobility?
If you go for the there's strengthening and mobility exercises. If
Okay.
go for the strengthening, then you have to go for prone raises
Okay.
exercises.
Yeah.
Either you can say hunchback
Yeah.
exercises. Okay, so we have a YouTube channel also. This we uploaded the hunchback exercise. Maximum time we'll ask our patient to do follow that particular thing. These are the prone raises exercises. I, Y, and T.
Yes.
And, just strengthening the
Okay.
scapular region, posterior side. And for thoracic mobility, you will go for the open book exercises. And
Yes.
Surya Namaskar will help a lot for thoracic mobility, but we do additional of that particular thing.
Right.
That's chest opening exercises. They are the most important one because you need to stretch the pecs
Yes.
for increased thoracic mobility. So we go for mobility as well as strengthening, and we'll do chiropractic manipulation obviously for 2 to 3 sessions in a week. So that
Yeah.
will help. Immediately that will help. If you sorry, what happened, Bhavna, exactly? If we are taking take care of the golfers. If they have stiffness for the left side, the maximum time their ball is going to the right because
Correct.
mobility is not proper. They have to be move and take the shot.
Hmm.
Maximum time they're hitting right side, not straight way.
Yes.
So just we need to fix that. If the mobility is okay, then they can go as per themselves. And for particular that thing, they are hitting right side, and they uh, take a lot of push from the body, and they are hurting the elbow, shoulder, and all these things.
Right.
So this is the role of mobility exactly to them. And That's very easy for us also
Yeah,
for that particular thing.
yeah.
Even though
Eh,
even though these people are going for the regenerative medicines,
right.
PRPs, SPCs, bone marrow for elbow,
Mm-hmm.
because our lot of patients are going for that particular thing. In these cases, also this we need to rehab thoracic mobility. Either they will injure again. If
Yeah,
they don't have the good thoracic mobility, they will injure
right,
again. That's a,
right,
this is the normal program: chiropractic manipulation, mobility, and standing exercise.
right.
That's all. Open.
Thank
Yes,
you
please.
for sharing, because this is such amazing knowledge that I never, I never came across. And like I said, for elbow, I treat them like just elbow case. I like to cover a joint before and a joint after, just for strengthening purposes, because body should be seen as one body, as a whole,
Mm.
and not just as one part or one injury. So I like covering that. But I do retraction, but so much mobility in detail, never done. I'm gonna start applying that.
With adding of your experience here, you will do.
Yes, now
Because
I'm gonna add.
yeah,
I'm gonna give you good feedback. I'm gonna let you know how it goes for my patients.
that's great. That's great. Yeah,
Can
please.
you tell me more cases? What cases do you come across in your practice?
So we got all kind of cases, but you can say the maximum problems in our society are upper cross syndrome and lower cross syndrome.
Right.
Generally, lower cross syndrome they will come with low
Right.
back pain, but that is not low back pain exactly. It's a
Yes.
kind of a lower cross syndrome. Pelvic mobility is
Mhm.
not good, so just we need to maximum things. They come with low back pain, but we find out it's a lower cross syndrome.
The
They come with
adding on
neck
that,
pain.
just
Yeah,
adding on that, I have noticed very recently that for the lower back cases, like you mentioned, I have so many lower back cases, but most of them come with core weakness. It's not their back; it's weak
yeah, it's not
core.
very bad. Yeah, if we occasionally we do the test for lower back against the wall, we'll find it out the squelch tightness is
Right.
there. And maximum problem is due to
Right.
that only. क्योंकि maximum radiating pain in the legs, they are coming from either from QL or piriformis.
Right.
Now, 95% time they are due to muscles, not due to nerve. In the 5% there is specific back pains.
Mm-hmm.
Maximum time, 90% time this is non-specific.
Yes.
And the same neck also. It's like give the mimicry radiating pain of the nerve. Yes, 90% time in the radiating pain in the hand are due to scalenus muscle,
Yeah.
or you can say teres minor or round infraspiratus. These are the muscles causing radiating pain, numbness, kind of mimicry same. Okay,
Right.
and these are the non-specific pains. But if we concentrate over the trigger point of muscles, the pain will better immediately, or
Mm-hmm.
but either that will be a temporary relief, but in 10 to 15 sessions, 10 to 15 days, you can recover and help him do better. That's the
Right.
thing.
Yeah.
Yeah. But maximum time that will be non-specific. Maximum time.
Right.
That's not the radiating pain you do now.
That's good.
So just we treat wholesome about that particular thing. This is a kind of a wellness
Mm-hmm.
thing. We need to take care about the you can say weak abs, but you told weak core weakness, and this is go as per lower core syndrome. This will
Right.
help, really help to make that patient better, and they will understand after a time. These things are perfectly okay for that.
Mm-hmm.
Yeah,
Yeah. Thank you so much for
yes, please.
sharing that.
Yeah.
Moving on, can you tell me more about like any specific interesting misconceptions that you have come across in the field of healthcare, in the field of physiotherapy? Like people think what physiotherapy is, and it's completely different from what they believe.
The field of healthcare, sometimes we people think that sometimes we'll go very early judgment, in a lot of cases, very early judgment. And we say no, that he can't walk, he can't move
Yeah.
the legs, he can't do that. It's very early in lot of cases. That's one patient came to me. Uh, I generally I remember the name patients which are not completely recovered with us, or they have very specific case. These are the two kind cases I
Yeah.
remember a lot. Who recovered completely, most of the time I forget about that. But which we are not able to recover, I remember the face.
Yeah.
Whether that was the case, that we are not be recovered with our
Yeah.
treatment. So the one patient came to me. It's a very specific case, and his L5 is fractured, and that will overlap to L4.
Right.
I will share the pics also. I have some MRI pics with me. I will share you. But this is a complete fracture, and that overlapped. Is spine from here to here. I was seeing the MRI, and definitely I'll ask where is the patient, because if fracture is kind of that
Yeah.
patient will not come with MRI. Then I'll ask where is the patient. Then he told me that I am the patient. He came walking. I again taken the MRI and seen all of that.
Wow.
Says, oh, you are the patient? Yes, I am the patient. What happened exactly?
Yeah.
That's a long back. That's I've fallen from uh, from my house roof, kind of first floor. The fracture happened, overlapped, and Bhavna, that's they not undergone any specific treatment. That's was a surprising thing. This one
Yeah.
saint was passing from that area. He seen that guy is fallen down from there. Then he taken to the bed and just tie a rope in the
No.
whole body. And he asked him just keep him fixed for 3 months. Gave him food, everything, but don't move him. Okay. And that patient is not going to hospital. After 3 months, they will open the rope, what patient told me, and the slacks and everything start moving. That fixed over there. Because maximum injury is spinal cord, thus increase in transfer.
Right.
Where is the injury happen
Mm-hmm.
and you are transferring, that's the maximum injury placed. So
Right.
that injury is saved in his case. Either overlapped of that vertebrae and everything, he was did pretty well in life. He did his agriculture work for the years,
Wow.
and recently he came to me that's fallen from stairs. So these are the things, but generally I saw that MRI to a lot of people. They will show he never walk. He never walk. The legs will not move. That's maximum time. As people say, but this is very early to say for anything.
Right.
Okay, he can't walk and all these things because we have good knowledge as per us
Right.
in the medical
Right.
field. But I don't think so that is enough. Something is beyond that
Yeah.
also, because if we are reading any book, that's we are just getting the experience of that particular person,
Mm-hmm.
and he may not be reached the last point.
Right.
If you are talking to me, that I may not be reached to the last point for each and every case. Now, things are evolving
Yeah.
in healthcare. So anything can be happen. In a lot of cases, I see. So I see in a case of C3, C4 quadriplegia, and his hands are working. He's a techie guy now. He's working very good reputed company in India,
Wow.
but not supposed to be hands are moving for that particular thing. So these are the things what we generally see in rehab. Something very impossible thing is going to possible.
Yeah.
Don't know how that happened. Might be we don't have the perfect knowledge of that
Yeah.
particular thing. That
But
maybe happen.
again, the spine stability, it was so important, and I agree with that.
Yeah.
Most of the injuries happen because during transfer, and
Mm.
especially when I was doing my CPR course and advanced CPR course, they
Yeah.
told us like first check if there is any spinal damage, then don't even give CPR because
Yeah.
that is only going to worsen the patient's paralysis if there is any spinal cord injury.
Mm.
And most people fail to understand that, they just get excited and they want to do chest pumps and mouth to mouth, just try to save, try to do things instead of understanding the medicine or the reason behind it.
Mm-hmm.
Yeah.
As this, I try to show you this to check if that is possible for me. Yes.
Yes.
Are you able to see the spine?
Mm-hmm.
This, and this is the overlapped vertebrae over
Wow.
here.
It's completely beside it.
Yeah, completely beside it. And patient is walking. He did agriculture well, everything. He
Wow.
got this injury at the age of 20 years, and after that, he's right now around 60 years. Everything is okay. I think
That's amazing.
some. I think something are happened due to our negligence also. Transferring is the most important part.
Mm-hmm.
After that, that will bring a lot of injuries.
Yeah.
Okay, so that's well in a nutshell. I want to say that in a lot of cases we give very early judgment.
Yeah.
No, just over. Nothing is going to happen. But I think
Yeah.
so. Just we need to go beyond the point. That's where we get.
I wanted to ask you, you have so many years of experience. What do you think about the field of physiotherapy before and how much advancement and progress it has made throughout these years?
Us very good progress. You can say if when I started work, Pune, they have good awareness in Pune, but when I came to the Greater Noida,
Mhm.
Delhi area, awareness was less over here in Greater Noida, but generally awareness in increase. Right now, patients, 90% patient come us directly. In
Right,
2003, you can say 90% patients are referred patient and hardly 10% directly. But now things are completely reverse.
right.
Now 90% patients are directly to us. Means that people understand about the physiotherapy.
Yeah,
And a lot of progress happened in our physio and rehab, but as well as the recovery is slow. If I say that's 20 years before, with the very normal modalities, recovery was very good. But
right,
nowadays, we are using very advanced modalities, but recovery is slow. The main issue, what I think, what I go in my mind, is people are not taking enough rest.
right.
And because they, if someone injured the knee
Mhm.
today, then he want to join office from tomorrow. That's the particular issue, and they need to work their 14 hours, 15 hours. That's the normal working hours. So they are not taking enough rest, and that's the most important thing. Actually, people don't want to give healing time
Yeah,
to body itself. So that's the main healing thing. So what we do generally we place joint on a specific position,
right,
malposition, malalignment, just will fix that and body heal itself. We are
right,
not forcing body to heal. That's the thing. But nowadays, if I see, the people don't want to give healing time to body.
right.
That's the only issue what I see in field of rehab. If rest is more, then recovery will be faster
Right.
and very fast. Mm. And same thing as mental health again causes that issue. I came across one patient. He go on RTA and fractured. I think 7, 8 fracture are there, but most dangerous fracture are spine. He have 2 spine fractures also. Luckily, his spinal cord was not injured,
Right.
but he got that brain injury also.
Mm-hmm.
So I was thinking that's how he will recover.
Yeah.
He can't. This is a very big issue. But
Right.
that was a very early judgment. The brain was not functioning, and that will give the good time body to heal
Yeah.
because he was not pretty well with mental health due to brain injury. There's a lot of things are with him. No one can tell him you can't recover
Yeah.
because no even Google can't help him
Mhm.
to tell that you can't
Right.
recover, and we don't. He will not accept us also because he is not mental
Yeah.
well-being. He recovered very
Wow.
fast. In 3, 4 months, he recovered. Oh, maximum time, just we are telling them we are not going to
Yeah.
recover. Either Google tell them you are not going to recover. Either their relative, friends, and family, they will tell them you are not going to recover, man.
Right.
You got the spine fracture and all these things. But luckily, he get brain injury also, and brain was not working very well, so he recovered fast.
He got enough time to rest.
Yeah, got enough time to rest because maximum time we are concentrating from the brain also. "Oh, no, I am not going to recover," and a lot of things, lot of viewpoint. People give a lot of
Yeah.
viewpoints. Doctors will give a lot of viewpoints. So we help them to recover, but we are supposed to be positive with their particular recovery and all these things, and we have to give to them a positive
Right.
feedback. Definitely honest feedback, but positive feedback
Yeah.
because we are not reached to the last point so
Yeah.
far. So we are not supposed to say this. This is the thing, and that will be the final thing, kind of that.
Right. Yeah. Do you think the competition and today's society is pushing us to, not take a break from work and just hustle, keep on hustling, keep on working, no time for rest?
Yeah, that's the main issue. That's the main issue. We have to be work on the 7 things around us,
Yeah.
but the first and foremost to ourselves, the
Right.
secondary to God,
Mm-hmm.
and third, we have to, if we are not married, then parents. If we are married, then to our wife. And the fourth is our parents if are married. Then fifth, our children. And sixth is our relatives and all these one. And seventh is work. But
Right.
we work on completely reverse
Yeah.
thing. That work is first and
Yeah.
foremost thing,
Yeah.
and rest is back to us. That's the only thing. We are not arranging things in a perfect order. That's only give that hustle and everything
Yeah.
because just we need to work with ourselves. After that only just we can give anything to society or anything to country or at any point to our
Right.
family, parents and children. It's everything just after me
Yeah.
overall.
Yeah.
So we have to be taking non-negotiable time at least for 2 hours for
Right.
ourselves. That is,
And
mm,
I completely agree with you.
yeah,
We have been living a very backward life for so long, and it has become so normal that we keep work and work first. That's why it's so huge. The work-life balance is so important that
yeah,
you have to balance your work and you have to be able to balance your family, your life as well.
agreed, completely agreed.
Yeah.
We need to work that particular thing.
Yeah.
Yes.
Can you tell me about the healthcare system in India?
Uh, Healthcare system is maximum in private
Mm-hmm.
hands, and government is doing pretty well. In
Right.
defense sector, they are developing good healthcare as well as for the normal persons also. But now we came with Ayushman card. This is a coverage of 5 lakh for persons who are BPL. So
Mm-hmm.
the government is giving good things. As 2 3 cases come across to me, they develop the carcinoma and they are taking treatment with Ayushman card.
Right.
They don't have money, but every year they are just spending 5 lakh with Ayushman card. So the healthcare is improved a lot, if I say, compared to before.
Yeah.
And this is a evolving process. Healthcare is doing pretty
Yeah.
good nowadays in India. As things are getting better,
Yes.
and there is good competition, and there's a positive competition in private
Right.
healthcare that will help to developing the things around us.
I'm
Now people are getting
happy.
very good treatment over here.
I'm so happy to hear that. I really enjoyed doing my internship and my bachelor's. I have experience from India, and I keep telling my patients that the therapist that I am today, it's all because of my knowledge and my experience from India. And that played such a huge role. I'm able to see multiple things, like able to do multiple tasks, have my mind around a few things, in spite of the fact that, over here it's like you have to focus on just one patient, but we get so much flow of patient in
Yeah.
New York. I'm talking about New
Oh,
York, which is so similar
really?
to, yes, I see. There are days, I'm not going to lie, I and my aide, so I have an aide with me who works with me. She's amazing.
Okay.
She's from Colombia, and she's really awesome. I love her. Us both, we see 7 to 8 patients in 1 hour. There
That's great.
there are days like that, yes, where we're handling so many things. But the thing is that I know the patients. The patients know their routine. They're used to what they're doing. They enjoy coming and working out. So that's good. That's a good routine. That's a good rhythm.
It's
But
a good number. 7 to 8 is a good number in 1 hour. That's
sometimes
pretty good.
there are busy
Yeah.
days, but there are
Yeah.
sometimes, usually, normally we see 3 to 4 patients an hour.
Hmm.
Yeah.
That's good.
Uh,
Okay.
so
Okay.
that comes from the fact that in India I was able to, because we have so much of population, and I did my bachelor's from DY. So I was
Mm.
practicing a lot of time in DY Patil College of
Yeah.
Physiotherapy. And
It's a good college and they have a good setup also.
yes, I
Yes.
I really miss DY and Dr. Tushar Palekar, our
Okay.
principal sir. I didn't get a chance to meet with him now when I was in India. He was traveling, and then I had to fly back to New York. But I would love to, we still chat, we still talk, but I want to connect with him again, and I want to do a few projects with him as well. And he's really an amazing man. He's handling the
That's great.
physiotherapy college really well. Our OPD is really amazing. If you see, we also were given two three patients in circles, and it was good experience to
Mm.
handle patients with care. So
Okay.
working on the quality of your work.
Okay.
And I can say very proudly that my quality of my work comes because of my practice in India.
Mm.
Like, none of my patients will feel like, oh, I'm not satisfied. They will be 100% satisfied. And it only comes because I've seen the work. Like, today I had a patient. He told me that he transferred to my location because there, just for the name of physiotherapy, they just gave him a hot pack. That's it. That's
Okay. Okay.
physiotherapy. So I was shocked. I was like, no, we're not doing that. I know we're waiting for MRI. We
Mhm.
were waiting for his results and nerve testing and all. We didn't push, but that doesn't mean we will not do anything. We'll do a few activities that are safe for you.
Obviously.
So did a lot. We did an hour, 10-minute session with him. He felt good after a session. So yeah, the quality of practice in India is definitely good. So I'm very proud and happy about that.
Yeah, that's very good because we learn a lot from our patients and the patient flow that will help us to learn completely. Even I have multiple hands over here. That's I have a very good team
Yeah.
and very honest and big team, and that's my team. That's always they are working with all patients and give very good results to
Mm-hmm.
the patients.
Yeah.
I'm proud of my team also, their honesty and their working, they are hard working for that particular thing. That's the only give us to liberty to think the to move the things further way for rehab and everything, how to increase the things. It's really
Yeah.
good and to enjoy our working. Yes, please.
It's very important to have a good supportive team.
Yes,
Yeah.
definitely. These are the hands,
Right.
and these are our colleagues, so we can do
Right.
very good every
Right.
time.
Yeah.
Yes, please.
I have a wonderful team. My receptionist, my front desk, she and my aide, lovely aide Viviana. They are amazing. They work so well. They understand, without even me saying, I just look at them and they'll be like, okay, I know what you need. I know what you're going to do next. So I love the flow
Yeah,
and the rhythm that we have. It's very important to have a good practice.
yeah, really. That's play an important role, day-to-day important role,
Yeah.
because your lot of time, you can save your lot of time if people understand what you exactly want
Mm-hmm.
for that particular patient. That's really good
Yeah.
to do that particular thing.
Yeah,
That's
definitely.
great.
Any last words of motivation that you would like to share with all of us?
Oh, that's I'll keep motivating myself only. That's the only important thing that I told earlier also. That we have to be take care of ourselves.
Yeah.
That's the only thing. Because if we love ourselves, then we can love to others.
Yeah.
We can understand their issues, their problem, as a thing. Nowadays, there's a lot of you see in this Modi ji, this is dressed well and everything is good, and you can say this. People say that he's using a lot of hairdressers and all these things as he manages
Yeah.
well. Then someone told that we must be look like that only.
Yeah.
Yeah, we must be look like that only. This, if we are good, we are looking good, we are looking healthy, then only we can do things for the others also. So love yourself,
Yes.
and that will definitely give you a good passion to working around you also, and that's love to your team and love yourself. That's only motivating thing to your workplace.
That's a lovely message.
Yeah.
Thank you so much, sir. I enjoyed this session, and I hope we can do more of these sessions. Thank you for taking the time out on a
Yeah.
Sunday morning in India. So thank you, Saurabh, if you're listening, for organizing the whole event. You did
Yeah, yeah.
awesome, and
Is
I'm
the
gonna
is the technical hand for
yeah.
me. Is a technical hand for me.
Yeah.
That's the thing.
I'm gonna text you Saurabh soon, but thank you so much, doctor. And
Yes, the next
so,
time just we can talk to any particular thing,
yeah,
either any particular joint. If you can go ahead,
we can have a lecture series.
we'll plan.
I can see
Yeah,
that happening. We can sit and
yeah,
talk about our patients, and it was lovely.
yeah.
I loved the session. You taught me so many things, especially the thoracic mobility.
Mm.
I can't wait to try it on Monday.
Thank you, Bhavna. Thanks for your time and your
Yeah.
way. Thank you.
Thank you.
Bye.
See you soon.
Okay.
Bye.
Okay. Bye. Thank you.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.